A study published in the New England Journal of Medicine found that patients with microplastics lodged in their arterial walls were 4.5 times more likely to experience a major cardiovascular event like a heart attack or stroke within 3 years compared to patients that did not have microplastics in their arterial walls. Microplastics were detected in 58.4% of patients undergoing surgery for heart disease. This suggests that chronic exposure to these particles could be playing a significant role in cardiovascular events. What's happening here is likely twofold. First, microplastics can promote chronic inflammation, which is a key driver of atherosclerosis, or the buildup of plaque in the arteries. Second, these particles carry harmful chemicals like BPA and phthalates directly into the arterial walls. So these chemicals may further contribute to the formation of plaque and may also increase the risk of heart attack or stroke. Another concern is the link between BPA exposure and hypertension. In a randomized controlled trial, researchers found that participants who drank from BPA-lined cans experienced a significant spike in blood pressure, about 4.5 millimeters of mercury increase in systolic blood pressure within hours. So the lead researcher of this study warned that repeated exposure to BPA could be contributing to chronic hypertension. This is a condition that's already affecting nearly a third of the global population. High blood pressure is a major risk factor for heart disease and stroke. So this connection adds another layer of concern regarding everyday BPA exposure. But what's even more concerning is how chronic exposure to BPA may drive cardiovascular mortality over time. A study that analyzed NHANES data from over 9,000 participants followed people for about 9 years and found that those people with the highest urinary BPA levels were 1.76 times more likely to die from cardiovascular disease. Interestingly, these effects were far more pronounced in women. So women in the highest exposure group had about a 2.8 times higher risk of a cardiovascular death compared to women in the lowest group for BPA levels. For men, there was still an elevated risk, but it was not as extreme. So this isn't just about BPA raising our blood pressure in the short term. We're talking about a serious long-term risk of dying from heart disease. And it appears that women are especially vulnerable. And again, it's not just BPA, but also the microplastics themselves accumulating in the arterial walls and possibly increasing heart attack risk.